Welcome to Health Matters, a program featuring healthcare professionals teaching you how to take charge of your well-being and to let you know that God wants you to be healthy. Let's join the discussion now. God bless you.
Hello viewers, you're welcome to Health Matters. I hope you're doing well with our health and I hope we're living stress-free. Have you watched our the issue on stress, the Health Matters we did on stress? Please, if you have not, please kindly go and watch. And then if you are joining us for the first time, please subscribe to Revival and Reformation TV and make your comments. God bless you as we receive you onto this program today. We have with us our bishop. For those who have been following us, he is a health consultant, like we have told, he's an health coach. He is an intercessor. He's a prince from Badagry, a general overseer, Bishop Theophilus Ajose. Bishop, you're welcome once again.
Thank you, madam.
You're welcome, sir. We have another interesting topic today. It's called prostate cancer. Prostate cancer is a cancer that is prevalent with men. It's a male gender prostate. It's a male gender cancer. And if you go to Google and check, 100,000 plus men in Nigeria every year have this cancer. And you know that all the 100 definitely will not survive it. So, and we feel that it's something we need to discuss. It's something we need to intentionally look at. And I'm believing that for this 30 or more minutes that we will be on this program, that the Lord will illuminate and get us to know how we could prevent ourselves from this cancer. And peradventure, it even happens, what do we need to do? That is what we want to look at. Thank you. Bishop, over to you, sir. What is prostate cancer in men?
Okay. Viewers, good day to everyone over there. You are welcome to the Health Matters platform again. A lot has been said about prostate cancer, but we have to look at it from the primary name, prostate.
Okay, sir.
So that we can better understand, how the cancer develops in the first place.
Okay.
And the prostate is a medium-sized, disc-shaped organ, that carries the seminal fluid, and sperm, through which the sperm moves during sexual intercourse. So it's located, in the penis, around the scrotum. So when we are now talking about prostate, we are talking about two things that a lot of people are not aware of. There is what is called prostate enlargement.
Okay, sir.
Or BPH. BPH is a non-cancerous, enlargement of the prostate. BPH, prostatic hyperplasia, benign prostatic hyperplasia, BPH, is just the enlargement of the prostate. You understand? How does this happen? Actually, when we are talking about prostate cancer, according to Mayo Clinic, doctors have not really agreed on what causes prostate cancer. But they can tell us some processes, physiological processes that take place in the man's body that leads to this.
Okay, sir.
You understand? And also, when we are talking about BPH, that prostate enlargement, which is different from prostate cancer.
Okay.
You understand? So some people can have prostate enlargement, and which is not cancerous. So they may not be able to have they do not have cancer.
Cancer, okay.
But BPH or prostate enlargement also causes some discomfort in the person, like erectile dysfunction, painful urination, and all sorts of things. blood coming out, during sexual intercourse in the semen and all that, or even in the urine. Waking up in the night to urinate frequently.
Okay.
And this happens because the cells of the body are meant to be renewed from time to time. But there's a hormone called DTH that, the androgen receptor, that prevents the death of this cell. So instead, makes them to multiply.
Okay.
You understand? And also, if it is not treated, it can lead to a severe medical condition. If not treated.
Okay,
It's usually severe. Now, when we are talking about prostate enlargement,
yes,
we need to know that when these cells proliferate, then it makes it difficult for urine to pass through the tube, or even semen during sexual intercourse.
Okay,
and so that creates some pain and other
difficulties.
So when it's not treated, then that is when it grows into all these cells that are multiplied become cancerous.
Okay, so is it age related, sir? I would like to know.
Yes, from research, it has been shown and proven that men from the age of 50, and above suffer from prostate issue. Although very rarely have been found in people like 40 years.
Young men. It's not a boy's disease at all.
No, it's not.
Okay.
It's not.
Okay, sir. Sir, what can we say are the symptoms, the signs? Because we learned that if you if you detect early, it's curable.
Yes.
So what are the signs? What are the symptoms for our viewers to look out for? Our men that are watching, or even women that can pass the message to their spouse. What are the signs?
You see, there are something they call incontinence, the inability to pass urine freely. In younger men, when they urinate, you see they can shoot out to how many meters when you are urinating. But in older men, it's just few meters. So not only that, they just urinate, it comes out a little stuff, intermittently, and they have to struggle, or some have to even, breathe in one way to get something come out.
That means it can become painful?
Yeah, it can become painful for some people, and all that. Then, another thing is that you see that in some men, they pass out urine now, it looks as if it's okay, but by the time they get out of the bathroom, another one is coming out. So it looks as if they are peeing their pants or something, because it's coming out in trickles.
Is it that they can't control it?
It's not the cancer, it's the way the cell of the prostate gland. Don't forget that there is now an increase in the number of cells in the prostate gland, which is blocking the bladder is full, it wants to come out, but something is blocking its free flow. So of course it will be coming out in trickles as well. But you want to empty everything when you get to the bathroom. You understand? So that's one of the signs. And this also may lead to erectile dysfunction.
Okay.
Inability to have full erection and all that. Because of the way the BPH or the cancerous cancer is now operating in the person. And also some medication some other people use can also lead to erectile dysfunction. And we have also seen that, like people that are diabetic, some of the medication they use lead to erectile dysfunction. Even people that have BP.
But not to prostate cancer.
Not to prostate. That's why we are saying now that when you have erectile dysfunction, it may not be solely due to prostate.
Prostate, okay.
So if there are no other pre-existing medical conditions, then you can now narrow it down. Maybe it's prostate. That's why irregular urine flow can also be a sign of.
Bishop, I would like to ask as we go on, if you are diabetic, are you open to having prostate cancer in men? Does it go hand in hand, kind of?
No.
It doesn't.
No.
It doesn't.
Prostate cancer, like we have said, is the proliferation of cells of the prostate gland.
Okay, sir.
Due to inability of the cell to die.
Okay.
You understand? And be renewed. Then it's being multiplied.
Right.
You know. So that is what even leads to the cancerous stage
Okay.
of prostate cancer.
Because it's not dying for another to be renewed.
To be renewed, because the way God made the body is, our body is renewing cells all the time.
But these ones don't die. They just begin to
The increases. So you have more of it. You know.
So like Bishop said, symptoms, and I want you to take note of this, when you cannot urinate freely anymore, when there's a struggle in your peen and it becomes painful. Am I right, sir?
Yes.
When you can't control your urine, you know, you leave the loo, and the next thing is that you've just found out that you're urinating again.
Or you have blood in your urine.
Or blood in the urine.
Or blood in the
Please
semen.
take note, viewers. Blood in the urine or in the semen.
Yes.
So, okay. When
or bone pain.
Or bone pain. And then erectile dysfunction.
Yes.
You know, when you cannot have a proper erection anymore, could also be a symptoms that you might have. So please, let's take note of these things. It doesn't mean death. It's not the fact that you have these symptoms. It's not a death sentence.
But prostate enlargement does not actually kill. It's not life-threatening.
So are we?
You know,
Yes,
it
are
can
we
be
hearing
managed to shrink.
Okay.
You know, the prostate gland. It's not. It is only when you get to the cancerous level that is issue.
So that means the enlargement can actually come into a blown cancer if it's not properly treated.
Yes.
So viewers, you have heard
Or
that.
if you see yourself losing weight unnecessarily, like you are not dieting and you are just losing weight unnecessarily, you have to check that.
Check that also. And for viewers that are joining, this is more of the male gender that have prostate. It's just like when we're talking about breast cancer. Men don't have breast cancer, but prostate is basically a cancer related to men. So let's take note of those symptoms. I'll probably relate it to you as we're rounding up. Sir, in what way? Now that we know the symptoms, we know the signs, how can we prevent it? Is it preventable? Is it something that is possible? Is there anything that elderly male, when you say from 50, that they can begin to do now, maybe even from their late 40s, just to make sure that they don't come into this problem?
Well, before that, we have to look at the risk factors.
Okay.
Risk factors are things that are either present in your body or in your family history that can trigger that.
Okay, please explain to us.
You know, apart from, we have said that it occurs in men that are maybe 50 and above. You understand? Then obesity. Okay. So if you are overweight, in fact, most men that go through this, you know, are also obese. So weight control is key to maintaining this. Weight control is key.
Okay.
The race factor, it has been scientifically proven that prostate cancer occurs more in black men than other races.
Really?
Yes, so
black men.
So Africans must be intentional about.
So it's in our genes, kind of.
Something like that.
Of our bloodline.
It's not in our fault. You know. Okay. So obesity is a risk factor. You know, family history is a risk factor.
So that means that if somebody has had it in the family, there's a tendency that you also might.
Or if somebody's mother, for example, has history of breast cancer, we call it BRCA1 or BRCA2, then that person also must actually be on the lookout to do something against prostrate. So it can be genetically transferred. Yes.
Viewers, I hope you are hearing that. One, if we want to prevent obesity, when you're obese, when you are fat, the tendency for you to have it as an elderly person, you're more susceptible to having prostate cancer. And then it's hereditary. Maybe your grandpa had it. Then that means you have to be cautious. You must intentionally, do everything to prevent it. Because like Bishop said, it's hereditary. It's in your bloodline, and you don't want it passed on to you or to your children. It's something that is common with black men, like he said. So let's take note of these things. Sir, what are the treatments? Maybe I would like you to start first with Abba. If you have been diagnosed, because you have to be diagnosed, you have to go to the hospital
Yes,
for
yes.
test.
The measure, yes, there's a test.
There's a test,
that measure
okay.
the size of the prostate gland, and doctor will tell you.
Is there a particular clinic for this? Do you know?
No, most medical laboratories do that.
Okay.
You know, there are a lot of them in Nigeria, in Lagos. They do all these things.
You just walk in and say you want to have a test on.
But yes, or you tell your doctor will refer you.
Fine.
You will tell them what to look out for and all that. But you know, with that, or if people do full blood count or full blood works, they will be able to do that test for them too.
Alone. So when this has been discovered that you have prostrate, what are the treatment? I want you to start with the herbal first.
Like I said, there are two types. You should not confuse them.
Okay, sir.
There is, prostate enlargement, BPH, which is different from prostate cancer.
Cancer. Okay, good.
So prostate enlargement, you are still on the safe side. It's not yet cancerous, and it's not life-threatening.
Okay.
It can be dealt with, treated, and it's just an enlargement which can be reduced. Even by so many things like eating habits.
Okay.
Our eating habit, like eating more vegetables, organic things, can help. It has also been discovered that most people that have prostate enlargement have low testosterone level, and they have low vitamin D, in their system. So, boosting this and zinc, boosting this with dietary lifestyle and changes can help to shrink the size.
So, what are these dietary life?
For example, there's what is called lycopene. Lycopene is in so many of our vegetables, like potato. Potato is the richest source. Watermelon too. Recently, we discovered to have more of lycopene, and we have guava and all those things. So, eating for men, eating a lot of tomatoes is good. But one drawback of tomato is that it causes, how do I put it now? It's hard on the stomach wall. The stomach wall is just one cell thick. So anything that scratches it, so it has been discovered that tomato, has an effect on the stomach wall, lining or stomach wall. So what we advise is that you cut your tomato or grind them, before you take them, so that you can get benefit of both the lycopene and having a good stomach lining. So
you don't advise the fresh just eat.
No, it's the fresh one, but you cut them more into pieces, or you chew them properly in your mouth before you swallow. So that you cannot.
Any other herbal? You have talked about eating healthy. I mean, we have heard that. But is any herbs that you think can prevent?
Yes.
Or treat
when we see
the enlargement.
When we see and discover that there are some things that are noticeable in people with prostate enlargement, is that number one, they have low testosterone level, they have low vitamin D level, and they also have low zinc level. So any food that can supply this will help in shrinking. And number one, apart from the lycopene containing food substances like tomato, guava, carrot, and all that, you also want to take pumpkin seeds. Pumpkin seed is very high in manganese and in zinc and in protein. And also taking these, in fact, research has shown that it shrinks the prostate gland a lot, pumpkin seed. And it's everywhere. You can get it on Jumia. I order on Jumia. You have the superfood brand, then you can buy on Jumia to take. Then another one is saw palmetto. Saw palmetto is an organic herb that is native to Southern America, but it's everywhere now. Saw palmetto has particularly been researched by the medical science to shrink the size of the prostate. And it's everywhere, like they have the herbs in capsule form. In so many of these good pharmacy, they have the extract. I would advise that if you want to get the powder form that they are formed into capsule, which is directly from the herb, it's okay, which has lower milligram of take. But if you get the extract one, it's okay, but that one, I think it has high content, but you have to take little.
Little
The
by
instructions are there,
Okay,
but the most important thing that sulfamethyl is very, very, very good in combating prostrate BPH and reducing the size of the of prostrate gland. Then another one is ashwagandha. Ashwagandha, ashwagandha is a favorite herb that increases the testosterone level for male. That's the male hormone,
yeah.
and it's also because when men are growing older, the testosterone level drops
naturally. Okay.
It drops. So there are a lot of lifestyle you need to incorporate, which includes some of these herbs, regular exercises. In fact, I have been shown that taking walk, 30 minutes walk for 5 times a week can help in the prostate health.
Okay.
Then people can be doing Kegel exercises.
What's Kegel?
Kegel is bending down, like this, squatting with your leg wide, like this.
Okay.
And some do it with your back lying down, and all that.
For like how many minutes?
It's great. Well, as long as you can do, but minimum of maybe 5-10 minutes a day is okay for you. But doing this with your wide open helps also your prostate area to be free of that, and it helps a lot, including work exercises. And one of the things men have to avoid is wearing tight pants, underwear. Tight pants is not really good because number one, it increases the temperature of your sexual organ, your scrotum, which is not really good for you, and it also promotes this type of enlargement and cell multiplication because the body temperature is very, very important. So you need to wear like boxers and all that. That's
something that is not tight,
that's
loose.
And all that can also help. Then if God helps you and you can engage in regular sexual intercourse with your partner, that will be
that
very
will
great.
help too.
Yeah, because so that can keep that place free, moving the semen. And,
so that means if you're not sexually active, the tendency for you having it is...
That is why it's been discovered that in older men, because sexual urge decreases with age in some people.
Okay.
Except people who are active, exercises, you take some of these vitamins and all that, because also testosterone level also drops. That reduces your desire for
sex.
Sexual activity. So which means the prostrate will not be, there will be free flow and all that. So you have been discovered that it affects men in that age category, or those who are not engaged more
in sexual activity.
Yes.
Or even in physical activity too.
Physical activity too. That's key. That's very, very, very important. And all that. So saw palmetto, pumpkin seed, sunflower seed, ashwagandha, very good. You can Google them, get the correct one. And but it's one of the things also we have seen is that a lot of people after 1 week or 2 weeks, they forget about it. And
they feel better.
They feel better. Even if they don't feel better, they don't take it seriously as they should. So this thing is something you have to, some will be 3 months regimen every day, using all these things before you can feel okay, because the organ has been affected and damaged over time.
Viewers, I hope we're hearing that. I would advise us to, repeat, rewind, and pick out all these seeds that he has mentioned, and then the issue about us being active, because it's a age-related cancer. It is related with elderly men from age 50 and above. And like you said, your progesterone, if I'm not mistaken, testosterone reduces. So you need to intentionally be active. He has shown us the squatting. He has shown us that at least every day you must do like 30 minutes, walk and be active. And then sexual activity too. If you could keep that up, all of this would help.
Health Matters, a program featuring healthcare professionals teaching you how to take charge of your well-being and to let you know that God wants you to be healthy.